We're following the latest developments on the Republican-led effort to repeal and replace the Affordable Care Act.
The bill right now is going to move to the Senate, where there's expected to be some major changes. So for more, let's turn to Igor Volsky. He is the Deputy Director of the Center for American Progress Action Fund. Good to see you, Igor.
Thanks for having me.
All right, so now that the House has passed the bill, what are the main things you're looking out for as it moves to the Senate?
Well, I think the main thing, just from how people are feeling, is will members of the resistance, the folks who flooded town halls for all those months, will they come out and hold the House Republicans who voted for this thing accountable? And then how will the senators look at that? Will they believe that taking up Obamacare repeal, especially a bill that gets rid of the pre-existing conditions, is that going to be politically toxic? And if so, how will they change it? Either way, I think they're going to write their own bill. The question is, how are they going to solve this problem of covering people who are sick?
So the Republican argument, or critics of the Affordable Care Act, said, look, it wasn't working anymore. It's not working anymore. Premiums are skyrocketing. Insurance companies are leaving states. Now, the critics of this plan say, listen, if you have a pre-existing condition, you're probably going to pay a lot of money. It's a tax break for the wealthy. The question is, was it better to do nothing at all and stick with what we had before?
Well, there's no question that you needed to build on the framework that Obamacare set up. I mean, I think Democrats said that as soon as the bill passed. And it's not the case that Obamacare is dying, as they like to say. It's not. Yes, some insurers are leaving, but if you look at what a major insurer said yesterday, they're leaving because of the uncertainty over Obamacare that Republicans have created. And when it comes to what's happening in this bill, in terms of putting sick people into high-risk pools, we know that doesn't work. We've tried that before in states across the country. You could never pump enough money into this pool to cover just sick people who keep on using those benefits. And even the high-risk pool provision within Obamacare, there was a temporary measure. It failed because the concept of only insuring sick people and not having any kind of healthy people to balance out that risk pool, that doesn't work. Republicans know this. They just simply don't care.
So this bill would give states more control over health care policies, especially when it comes to covering pre-existing conditions. We know, or at least what we hear, is that the costs may rise if people fall off of that pre-existing coverage, fall off of that insurance. Why does the federal government need to be involved in health care at all? Why shouldn't the states themselves be able to handle it?
Well, Vlad, look at what happened before Obamacare. States could have solved the health care problem for the decades before 2010 when Obamacare became law. They didn't. And the reason is because to get this system started, to get everyone into the system, is a major investment. And the federal government is really the only entity that can make that kind of investment. And Obamacare did it in a way that created competition with private insurers. You know, a lot of us argued maybe you'd need a public option in there as well to bring prices down. That's, in fact, if you want to fix Obamacare, that's something folks and lawmakers should look at. But this idea that just leave it to the states and they'll solve it, I mean, they've had years to do this and they've done nothing. Obamacare brought the uninsurance rate way down. It's actually been working.
You work for a left-leaning action fund, but from your point of view, how do you see this impacting the 2018 midterm elections? I'm sure you saw on the House floor there the Democrats singing "Na na 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 goodbye" to the Republicans, suggesting that this is going to take them down in 2018. They won't get reelected. But what's your take?
Well, I can tell you that there is a lot of energy. There's a lot of energy out there, and now that this thing passed the House, there's a lot of outrage. And the question, you're right, the question for the next coming months and certainly the next year is going to be, are people going to be able to take all of this passion they feel in terms of confronting their lawmakers at town halls, of using different kinds of toolkits to hold members accountable and call their offices? Will they be able to take all of that and make change in the ballot box? Ultimately, that's what's going to matter in 2018. Certainly, there's going to be kind of a lot of momentum towards getting that done. But again, that is, in fact, an open question.
Yeah, and that is the question, I guess. How can the Democrats build off of this, Igor?
Well, you already saw, the Democrats started to run ads against Republicans for voting on this bill. By the way, many of them, as you guys know very well, didn't even read the bill before they voted on it. I mean, I think you had a member admit that last night on television. So they're going to use all of that footage, the fact that they had beer carted into the House right after the vote to celebrate, the fact that they took a victory lap after the bill passed at the White House. That's going to be a problem. The fact that there's going to be a Congressional Budget Office score that doesn't even exist after the fact, showing how many people would lose coverage. You're going to see that in campaign ads in 2018. It's going to be a big, big referendum on health care. And Republicans, I just can't see how this is going to be a political benefit to them moving forward, especially because ultimately what they passed is going to come back to them because the Senate is not going to accept it. So they just walked the plank on this thing. And I think they're going to be confronted by some angry, angry voters in the days and weeks ahead.
Yeah, Nancy Pelosi said that they'll have it tattooed on their forehead. They will glow in the dark. That was her line. Igor, Volsky, thank you very much.
Thanks, guys.